Welcome to Have More Babies. Today we're diving into something really fundamental for every parent. How to build a strong, trusting relationship with your child's pediatrician.
Yeah, it's such a crucial relationship, isn't it? We've looked at some great insights, particularly from places like Omega Pediatrics, to sort of map out how this partnership works best for your child.
Right. And our mission for you listening today is pretty simple. We want you to walk away feeling, well, more confident and comfortable working with your pediatrician.
Definitely, because that collaboration is key for your child's health.
So let's get started. Why is this connection, this trust, so incredibly important?
Well, at its heart, feeling comfortable and secure with a pediatrician, it directly impacts how open you are.
How much you share, you mean?
Exactly. How honest you are about what's going on with your child's health. And that honesty, that open sharing, is what lets the pediatrician, really provide the best care. It helps them tailor strategies that actually work.
And it's not just about the parent feeling comfortable, is it? It affects the child too.
Oh, absolutely. Think about it when your child feels okay, feels at ease during a visit.
Mm.
Maybe it's just a checkup, maybe something more involved. The whole thing just goes more smoothly.
Right. A relaxed kid means, well, a more productive appointment. Less stress for everyone.
For everyone involved.
Yeah.
Yeah. And ideally, you find a pediatrician who sort of clicks with your family, whose style works for you.
But what if you don't always see eye to eye on everything?
That can happen, of course.
Mm-hmm.
But a good pediatrician, even if they have a different perspective, they should always be willing to listen properly to your concerns and really address them thoughtfully.
So it moves beyond just a quick checkup.
Yeah, exactly. When you have that trust, it stops being just like a consultation, and it becomes more of an alliance, a real team effort.
A team focused on the child's health.
Precisely. And the absolute foundation of that team, that alliance, it's open communication. The actual appointment time is vital, sure, but it's the ongoing, honest back and forth between the parent, the child, and the doctor that really makes the difference.
Okay, so open communication is the key. How does that practically, benefit the child day to day or appointment to appointment?
Well, first off, it leads to much better information sharing. As kids get older, if that trust is there, they feel more comfortable speaking up themselves, taking some responsibility.
Sharing how they feel, maybe.
Yes, exactly, what they're experiencing. And pediatricians have, techniques, interview skills to help encourage that and guide the family to work together.
So it helps everyone get on the same page. What else?
Another huge one is diagnostic accuracy. Getting the diagnosis right often depends on knowing all the details. Symptoms, history, little things you might not think matter.
And parents are usually the ones with that info.
They're the primary source. So you really need to feel okay speaking up, sharing concerns, even small ones. It really highlights that teamwork aspect again. The more pieces of the puzzle the doctor has.
The clearer the picture. Makes sense. What about understanding what the doctor tells us?
Right, that's improved patient understanding.
Yeah.
A good doctor takes the time to explain things clearly, not in, complicated medical jargon, but in a way parents can actually grasp.
So you feel empowered to make decisions.
Exactly, informed decisions about treatment. You're not just being told what to do, you understand the why.
You feel like a partner in the process.
You are a partner, and that feeling, that understanding, leads directly to better adherence to treatment.
Ah, sticking to the plan.
Yes, because if communication is open, you work together on a treatment plan that fits your family. And if you have doubts or questions, or maybe it's just not working practically,
You feel okay saying
you
that?
feel comfortable bringing it up, asking for clarification, maybe adjusting the plan. We all know sticking to treatments, especially with kids, can be tough.
Oh, yeah.
So being able to talk openly about those challenges, it makes a real difference.
Okay, that covers a lot. And the overall experience.
Well, finally, it just enhances the whole healthcare experience. Let's be honest, pediatrician visits can sometimes be stressful.
For parents and kids.
Definitely. But when you have that open communication, that trust, it takes a lot of that stress away. Your own comfort level really influences how your child sees and experiences those visits, too.
That makes total sense. Okay, we see why it's so vital. Let's talk practical steps. What can parents actually do to build this kind of rapport?
Okay, yeah, practical stuff. First, just be present. Really be there during the appointment. Engage in the discussion. Ask your questions. Share what you've noticed.
Don't just sit passively. Got it. What else?
Respect their time. This sounds basic, but it matters. Arrive on time. If you have to cancel, give them as much notice as possible.
Common courtesy, really.
It is, but it contributes to a good working relationship. And treat the doctor and the staff well. Kindness goes a long way.
Absolutely. What about the communication piece itself?
Practice that open communication proactively. Don't hold back concerns thinking they're silly or too small. Voice them. And encourage your child to ask questions, too, when they're old enough.
Maybe even write questions down beforehand.
Oh, that's a great tip. List your questions. Bring any relevant records, maybe a list of current medications. Being prepared helps you use the time effectively.
And ensures you cover everything. What about the information we give them?
Be honest, really honest, about the health history, symptoms, medications, everything. Accuracy is just critical for an accurate diagnosis.
Even if it's something a bit sensitive.
Especially then, it's all aimed at getting the best care for your child. Transparency is key.
Right. And listening.
Yes, communication is two-way. Listen attentively when the pediatrician explains things. Maybe take a few notes if that helps you remember.
Good idea.
And, show you appreciate their expertise. A simple thank you for their time and explanation can really strengthen that connection.
Acknowledging their effort. Nice touch. Any final practical step?
Yeah, build a relationship over time. Schedule those regular checkups. Follow up when needed. Consistency really helps build familiarity and trust. It's not just a one-off visit.
Right. It's an ongoing partnership. Now, you mentioned teamwork earlier, raising kids, dealing with health stuff. It takes a village sometimes, doesn't it?
It really does. And it's okay to acknowledge that it's challenging and that help is available. Your pediatrician is a huge part of that support network.
So how do they fit into the bigger picture, maybe with school or therapists?
Well, being proactive means working with all the support systems. And your pediatrician is often central. As your child grows, their needs change, right? So the approach needs to be dynamic.
Care for a baby is totally different from care for a teen.
Totally different. And if your child does have a specific medical condition, keeping everyone in the loop, other doctors, therapists, school nurses, teachers maybe, is so important.
Keeping everyone on the same page.
Exactly. You want a coordinated effort. Many pediatric practices really embrace this team-based care idea. The main players are you and your child with a pediatrician, but they coordinate with others when needed.
Like a healthcare superhero squad.
Yeah, something like that. With you and your child at the center directing the mission.
I like that. Okay, let's shift gears slightly. How do we help our kids engage with the pediatrician? That can be tricky, depending on their age.
Oh yeah, definitely age dependent. For infants, it's all about positive sensory experiences. Soft voice, calm music maybe, gentle touch.
Making it feel safe.
Safe and soothing. Breastfeeding during the visit can be comforting. Simple interactions, singing, peekaboo, silly faces, creating positive associations early on.
Okay, infants. Positive vibes. Toddlers. They're often a bit unpredictable.
Toddlers, yeah. Having a familiar face, like you, present is still key. Let them sit on your lap if possible. Offer really simple, realistic choices. Do you want the doctor to look in this ear or that ear first?
Giving them a tiny bit of control.
Exactly. Distractions are your friend. Singing, books, maybe a small toy. Explain things very simply, focusing on what they'll feel or see. This light helps the doctor see in your ears. And don't give them too much advance warning. Maybe the day before is enough.
Keep it simple. Offer choices. Use distractions.
Yeah.
Preschoolers. They can understand a bit more.
Right. Still good to have you there. You can offer slightly more complex, but still age-appropriate choices, like the order of the exam parts. Maybe involve them in tiny ways. Can you hold this cotton ball or help me open the Band-Aid?
Making them feel helpful.
Yeah. Let them choose their distraction, a favorite book or toy. Reading books about going to the doctor can be great preparation. Pretend to play at home helps too.
Normalizing the experience through play. Okay, school-age kids.
With school-age kids, positive reinforcement often works well. Praise them for being brave, for holding still. Prepare them a bit more in advance. Talk about what will happen. Answer their questions honestly.
Give them more information.
Yes, and give them some control over coping. Let them choose, read a book, deep breaths, listen to music on headphones, hold your hand. And it's important to acknowledge feelings. It's okay to be nervous or cry, but we need you to hold still for just a minute.
Validating feelings, but setting expectations. Good. And finally, teenagers. A whole different ballgame.
Definitely. Privacy is huge for teens. Respect that during the exam. Tell them about appointments well ahead of time. Let them choose their coping strategies. Be really sensitive to their concerns. Body image, privacy from parents sometimes, peer stuff.
Showing respect for their independence.
Absolutely. Respect their independence, but still offer support. It's a balance.
So across all ages, it really comes down to tuning into their developmental stage and adjusting how you support them, how you engage them.
Exactly right. And doing that consistently helps build their trust with the pediatrician too, alongside yours. It's all interconnected.
It really sounds like that open, trusting communication is the absolute core of everything we've talked about.
It really is. It underpins everything: the trust, the information sharing, the accurate diagnosis, the understanding, the follow-through on treatment. It makes the whole healthcare experience better and more effective for your child.
Well, this has been incredibly insightful. For everyone listening who wants to explore this more, get more practical tips and resources on building that strong relationship, we really encourage you to visit omegapediatrics.com.
Yeah, they have some really great information there specifically on this topic, a very valuable resource for parents.
Definitely check it out. And if you found this conversation helpful today, please do give this video a like, subscribe to the channel so you don't miss future discussions.
And share it. Share it with other parents you know who might find this useful.
Absolutely. Spreading the knowledge helps everyone.
It really does.
Finally, maybe take a moment to think about your next pediatrician visit. How could you maybe implement just one or two of these ideas?
Even a small step towards more open communication or helping your child feel more comfortable can make a difference.
It all contributes to a better, more collaborative healthcare experience for your family.
Well said.
Thank you so much for joining us today as we explored building that vital pediatrician relationship.
Yes, thank you for tuning in. Hope it was helpful.
Goodbye for now.